increase in COVID-19 infections and deaths in the last couple of days have been met with a great deal of concern. Now, most of the new cases are found in Gauteng, KwaZulu-Natal and the Western Cape. Let me take you to Dr. Nicholas Crisp, who is the Deputy Director General for the Department of Health. Now, Dr. Crisp, people are very worried and concerned about this increase in numbers. Questions about whether or not this is in fact the beginning of the fifth wave, effectively, of COVID-19. As the Health Department, how are you analyzing these figures?
Good evening, Kathy, and hello to the viewers. So we've been watching, obviously we watch numbers every day, and we've been watching what's happening for almost 3 weeks now with the changes of trends of the variants. It's one of the sub-variants of Omicron that we've been watching in particular. We know that other countries have also had flare-ups with one of the Omicron sub-variants, which we do have in the country, but is not dominant here. So for now, it's still, during the weekend, it's quite difficult to see whether the figures are rising or not. They're down to 3,222 today, but that's the usual Sunday decrease, and Monday is also unpredictable. So by Tuesday, we'll have a better idea if this is sustained. But as you said in the introduction, it's urban areas that have had a concentration of these new cases, predominantly Gauteng, because it's almost all urban, Western Cape, around eThekwini and Mgungundlovu, so Pietermaritzburg specifically. But then the other urban centers in Gqeberha, in East London, and in the Free State as well, and in fact even in Kimberley. So urban areas have picked up small numbers, and that's added up to this larger number. So we are watching it and have been watching it for a while. There's no way to tell yet if this is just flare-ups, perhaps following Easter and with the new sub-variant that's dominating, or whether this could lead to the fifth wave. It's a bit earlier than expected, but it may well be the start.
When we look at that positivity rate, Dr. Crisp, it looks to me that, it's very high. Is it slightly distorted because of the low base that we're coming from? And is it really accurate to be comparing the positivity rate now versus what it was when we were at the peak of this pandemic, perhaps during the first and the second waves?
So we've had 4 waves, and they've all behaved completely differently, and the period between these major flare-ups has also been completely different. Between Delta and Omicron, the positivity rate was down to 2%, and in some days it was even lower than that. And now, after Omicron, we have never gone below 5%. In fact, I haven't seen it below 6%. So it has grumbled along where the number of tests we're doing has decreased significantly, dramatically in fact, and which is probably not necessarily a bad thing, because we have not been seeing a large number of cases. But as we start to pick up larger number of cases, we do need more testing to take place so that we can see where the infections are. We are starting to see a few admissions. It's not worrying at this stage, but we monitor very closely. What's interesting is that people who are getting sick now are largely unvaccinated, which we knew was going to happen and is to be expected. The public seem to believe that just because there's a higher amount of immunity in the community circulating from previous infections, that they are therefore all protected. That is not the case. And we know that you need to be repeatedly exposed to any virus, and particularly this one, if you want long-lasting and solid immunity. So you need, whether you were infected or not, you need to get vaccinated. You need to get a second vaccination of part of your primary dose, and you need to be boosted if you want to have a cellular immunity that will give you good and long-lasting protection against this particular virus.
Let's talk about the issue of variants, because that also is one that is closely watched by officials like yourself and others in the scientific world. From what you are seeing, are there big concerns about any significant variants that could change the course of this virus currently?
Okay, so now without getting into too much of the science and try and make it so that everybody can understand, viruses change all the time. some faster than others, and that's why we have a new flu vaccine every year, because the virus changes significantly from one year to the other as it moves around the world with the seasons. This virus, that is coronavirus, that is causing what the pandemic that we're seeing at the moment, has been mutating quite fast and has many mutations. When there are just 1 or 2 or 3 mutations on the gene structure of the virus, it usually is just then regarded as a subvariant, and depending on where and what those mutations are, it will perhaps marginally change the characteristics and the behavior of the virus. So whether it spreads faster, whether it attaches to our cells better, and so forth. But so what we are seeing at the moment is that we still have an Omicron. The gene sequence is an Omicron virus that is circulating. But it has a number of mutations in a number of different subvariants. So we know that subvariant BA2 is what's been causing trouble in China, for instance. We do have BA2, but in very small numbers, and it appears not to have spread rapidly in any of our communities. We also have BA.4 and BA.5, which have got slightly different mutations on their genetic structure, and it's BA4 that is beginning to become the dominant strain and taking over from the original Omicron as the more predominant strain. But the mutations are few, and it's difficult to tell whether they are going to be aggressive or behave in a completely different way. And it's only when you get significant mutations that a virus is given a different name and becomes a new variant as opposed to a subvariant. So without getting too technical, at the moment, we are still seeing Omicron. We are seeing slightly more numbers than we were seeing a month ago. And the numbers are starting to be dominated by one of the subvariants rather than the original Omicron that caused that massive fourth wave.
When it comes to your own projections, Dr. Crisp, what are you looking at in as far as when we are likely to see the full impact of a fifth wave?
Yeah, Kathy, that would be crystal ball gazing rather than good science. We're not sure if this is just as a result of people's freedom and moving around and a lot more exposure to one another, getting slack about mask wearing and hand washing, too many people unvaccinated, so not enough permanent immunity in the community. Those are all factors. So the other factors are that as the weather turns and becomes cold, we tend to spend more time indoors, and that means that we are more closely associated with one another. There's social distancing. Our resistance is a little bit down, so we start to cough and sniffle anyway. If the weather gets warmer again, we'll all start going outdoors. But so that is why we say the winter months are the ones where we would expect the next wave to occur. Now, we've had a cold snap recently. We also had a lot of public holidays recently. People have been socializing and generally trying to get back to some form of normality. So that it may be that is what we are dealing with now, and that we haven't actually got a new virus that is causing a fifth wave. So we don't want to be alarmist. Once we've had a look at the figures, sometime around about midweek, the minister will give a better description and tell everybody what we think is happening.
Dr. Crisp, naturally, when people begin to see these numbers go up now, it automatically conjures up, well, what does this mean for our lives? What can we expect? So as it stands right now, I mean, are there worst-case scenarios that the department is dealing with? And do any of those include a situation where we could still go back to a lockdown?
So the most likely scenario is that if we all behave and we all look after ourselves, get vaccinated, wear masks when we're in places where there are a lot of people crammed together, wash hands frequently so that we're not coughing and splattering our germs all over one another, we can pretty much contain severe infection. We are fortunate in a position that the vast majority of older people, older than 60, have been vaccinated. In some parts of the country, it's in excess of 75% of people over the age of 60 who've been vaccinated. In fact, more than 70% of men over the age of 60 have been vaccinated. So this is encouraging because that's the population who's at greatest risk of severe illness and ending up in hospital. But what we are seeing is younger people who have not had the risk and therefore perceive themselves to not be in danger, who are now more likely to get infected. And unfortunately, some of them will get seriously affected. So what we are asking people to do is to, irrespective of what the law or regulations may or may not do, to be responsible and to look after yourselves. And the easiest way to do that is now, before there's trouble, to get vaccinated and get your immune response up.
Dr. Nicholas Crisp, let's leave it there for tonight. He is, of course, with the Department of Health.